Put a smile on your face when you're moving from place to place. Good morning, good morning, morning, good morning, morning.
Welcome back to the morning show on Tobago Updates Television. We're coming to you live from Comfort Inn and Suites here in Tobago. And we continue conversations with our guest this morning. And we're speaking about the Cataract program in Tobago. And we're speaking with Dr. Nathaniel Duke. And we also speak with Professor Jose Ramon Ponce-Martinez, ophthalmologist. So good morning, guys, and welcome to our program. Welcome to Comfort Inn and Suites. Welcome to our show this morning. Right? We're talking about the Cataract, the relaunch of the Cataract program.
Yes.
So tell us a little bit about it.
Well, the Cataract program is a program under the Division of Health. And this was an initiative which was spawned from the Secretary of Health. The Secretary recognized that there was a burden of cataract and there was a significant backlog of surgeries which had to be done, especially for the elderly and for other patients in Tobago. So what she did, she indicated that we must clear this backlog before the year is over. And she came to us and indicated that she wanted this to be done. There was a lot of logistics which had to go behind and putting this together. And with the approval of Executive Council, because this by no means was an easy task to pull off for Team Roxborough. I say Team Roxborough because it's a young hospital, it's a young team, and we had to more or less retrain everyone in the cataract surgery procedures. So far, in collaboration with Very Medical, the Division of Health, and the TRHA, which are the facilitators of this, we have completed 580 cataract surgery so far. And our goal is to complete another 720 cataract surgery on or before the end of December.
Of this year?
Of this year, yes. I must say that this has never been attempted in any RHA in the Republic of Trinidad and Tobago. So therefore, all the other RHAs are welcome to come and learn from the Tobago experience. It's a very, very high volume. The team has meshed together, and this is all really working well because last week it was the world's celebrated World Sight Day last week, Thursday.
Right.
Because under the United Nations Charter and WHO, everyone has the right to sight. So this program, the re-execution of this program is well received at this point in time.
But the magnitude of this program, there must be a lot of logistics behind it. I know you mentioned that the surgeries have been done in Roxborough, at the Roxborough Hospital, and also that you had to retrain practitioners to do the surgery. So tell me some more of the logistics, some of the challenges that you might have faced, especially in the implementation process, and how things are working now. Because that's a large number of surgeries you've done, 580 you've mentioned, yes?
Well, one of the greatest things for us was, the easiest part was pulling the human resource together. There were a lot of enthusiasm among the staff, and working with nurses at various levels, one had to now teach them how to examine the eye, how to screen for vision. So we created what's called a mini factory, a process flow from the time the patient arrives, which stations they have to go to, and to be able to collect the data that is necessary so that the ophthalmologist can make an informed decision on who requires surgery and who does not require surgery. So that's the medical arm. And then we had to more or less upgrade our operating theater. So this actually triggered the activation of the operating theater services at Roxborough. With that, we recognized that the building itself, we were stressing on the facility, which is what we wanted to do. So there were some problems that popped up, so we had to deal with that. We also had to bring in the equipments from various parts of the world. So the logistics in bringing in the equipments from as far as Switzerland, all right? So these are state-of-the-art equipments that were made just for Tobago. And we also had to bring in the cataract packs, all the surgical packs and the lenses. Now, when you go through this level of screening, we have to ensure that the lens is specific for the patient. So the ordering and the background, and don't even talk about clearing stuff from customs. My goodness.
I know the challenge.
Yes. So when the team came together and everything was centered around the cataract surgeon, who we had to bring out of Canada into Tobago to lead the team. And without his expertise, none of this would have taken place. So all of this background logistics and preparation and simulation and working through the procurement with the division and the collaboration, all of this took place months in advance before the arrival of Dr. Martinez. Right? So to go to the logistics more was very, very complicated, but it was a challenge.
And I know you mentioned that you did 580 surgeries. What period was that? Because you're now saying you want to complete 720 and we're in almost to the end of October. And we want to complete these surgeries before the end of December 2023. So how feasible is that in terms of I know you said you have the human resources. How feasible is that in terms of your manpower and, everything that it entails to do these surgeries, or even an assessment to get these surgeries done?
Well, the assessments were done, the screening were done before. So we knew our patient selection was actually selected way before. Okay. So we knew exactly who were going to come, who qualified for cataract surgery, and we knew exactly what lens they were going to get. So these were all pre-ordered and arrived on island. We got the medications on island and were stored before. The 580 were done over a period of 3 months. But that was the first phase. And during that first phase, there was a learning curve.
Right, you're feeling through the process.
Yes. So in medicine, there's a learning curve. So the staff, they started off slow, and then they rapidly accelerated from where they were doing like 18 surgeries a day, and then they hit their plateau, 40 surgeries a day. So learning from that, we knew that we could have executed the 780 during this period of time.
Right, and I was going to ask about that. I was going to talk to Dr. Martinez about in terms of the numbers of surgeries that you all do on a daily basis and how manageable it is for you and the team.
Well, first of all, I have to acknowledge Dr. Duke's and the Division of Health organization and how they have been managed to train and motivate the staff at Roxborough, because it's been amazing. And I have to say the facility is state of the art. So how do we do it? Well, it's mainly a teamwork. It has to be a perfect organization at the background before we get into the operating theater, and the organization has been obtained here inside of the hospital to manage to have a very good process of like Dr. Duke said, it's like a factory. We have every step previously planned, and everything goes according to the plan most of the time. So that is helping us to do around between 30 and 40 surgeries per day, in between 6 hours, probably 7 hours.
7 hours, yeah.
But how long? Okay, I can't do the math.
Yeah.
So how long a typical surgery? How long does it take?
Between 5 and 10 minutes. Yeah.
It's that quick?
It's really quick.
I never would have thought.
Yeah, it's a really good surgery.
Could you I'm really excited to find out, right? Could you walk me through the steps, or at least give me some type of overview as to how a surgery of this magnitude could be completed within 5 to 10 minutes?
Oh, well, yeah, first of all, it requires a lot of training, a lot of practice. I've been done over 10,000 cataract surgeries. So you get to it. You get to it, right? And the team they have inside, the nurses that are helping me with surgery, they kind of read my mind, they know which steps it's next. So what happens? The patient gets into the theater, gets into operating table, they clean his eye, and we cover with a sterile field. Then I have to put a microscope over the eye, and then surgery begins, right? So it's several steps that has to be repeated every time. So if you repeat the same steps during the surgery, it makes it very quick.
Yes, what we call muscle memory.
Yeah, and you repeat the same thing.
Right.
Unless there's something different, the patient has some complication, or the eye is different, like it's very big or very small, or you have a very dense cataract, which is very common here, then you change some of the steps you do. But it's a very safe surgery. That's one thing that's very important. All the components around the surgery, the devices we use for the surgery that we brought from Switzerland, the instruments that we use, it's all planned to be just perfect, so we can do the surgery that quick. You know, it's
Right. This is really truly awesome. But how does one, Dr. Duke, how does one qualify for a surgery? What is the process to whether it's apply, or how do you qualify for the surgery?
Well, before we had a call to action where individuals who had cataract, they had either registered online or they presented themselves to the Roxborough facility. We also had a significant list, which was at Signal here, at the Scarborough General Hospital. So our mandate was to clear that backlog. So we already had a list to work with of several hundred. And then when we had the call to action, we recognized that it was over 1,300 patients. So we call all these patients in via an appointment schedule, and we were screening 60 to 70 patients a day. And we did that for weeks. So we knew who qualified and who did not qualify. Now, there was a point in time where we had to stop the screening process because the numbers were just growing greater than the program could accommodate. Yeah. So we actually knew what we had to do in terms of our numbers before. So patients right now who think they have cataract, and we are encouraging them to go to the Scarborough General Hospital eye department, where it will be confirmed if you have or not. And then they can send you on to us with a confirmed diagnosis, and we will take it from there.
And how long is that process, the wait time between having the assessment at the hospital and then coming to Roxborough? How long is that process before you actually are scheduled for your surgery?
That process can be as soon as 2 to 3 weeks, or as long as 3 months. And it all depends on various factors. What's your vision at that time? If you are really confirmed, if you are not confirmed, if you have underlying glaucoma, which is a major issue in Tobago. What we are seeing from our all of our testing is that glaucoma seems to be more of a burden in Tobago than cataract. As we crunch those numbers, we are seeing this.
Oh, yeah. Wow. Ladies and gentlemen, we're talking about cataract surgery, the cataract program being relaunched. And as Dr. Duke said, if you suspect that you might have cataract, the procedure is you go to the Scarborough General Hospital, to the eye department, and they will do their assessment, confirm your diagnosis, and refer you to the hospital. In closing, is there anything you want to tell our listening public, viewing and listening public this morning?
Well, from a medical point of view, as Dr. Martinez said, cataract surgery is safe. And once you are confirmed as having cataract, we are willing to do what we have to do to ensure that your sight does not deteriorate. One of the things that we must thank is the Division of Health. Because if it wasn't for their support, and by extension, the executive of the THA, this would not have happened. This is a very costly procedure. Also, Professor Martinez and his team to return to Tobago on so many occasions to help us pull this all together and execute this for the people of Tobago.
Well, ladies and gentlemen, we must say thank you to the Division of Health and TRH for this program. And of course, if you have cataract, the procedure is you go to the Scarborough General Hospital, get your assessment, and then proceed to the Roxborough Hospital, where you would have your surgery if you require same. We are going to go to a break, but of course, we continue our conversations with our guests in studio. So we're asking you to stay with us. And while you stay, we encourage you to share the live, share the live, share the live.
Good morning, good morning, morning, good morning, morning.